The notched delta pattern is a hallmark EEG feature in patients with Angelman syndrome. It consists of runs of high-amplitude 2 to 3 Hz delta waves that are maximal over the bifrontal regions, with a spike or sharp wave superimposed at or near the peak of the delta wave. In this EEG sample, we see a recording from a 3-year-old patient who presented with a first-time nonfebrile seizure and a history of developmental delays, clumsy walking, and characteristic happy demeanor. Despite the notched delta waves present in the EEG, there is no behavioral alteration during these runs, confirming that this pattern is not ictal. Here are some key features of the notched delta pattern. Frequency and location. High-amplitude delta waves at 2 to 3 Hz, typically maximal in the bifrontal region. Superimposed spikes. A spike or a sharp wave occurs near the peak, at the peak, or just after the peak of the delta wave. Non-ictal nature. This pattern occurs without behavioral changes, making it distinct from epileptiform activity. In children with Angelman syndrome under 12 years old, an additional EEG feature is 4 to 6 Hz rhythmic slowing with spikes in the occipital region, often enhanced by eye closure. While Angelman syndrome patients have a higher incidence of epilepsy, the notched delta pattern does not distinguish between those with and without epilepsy. The syndrome itself is genetically linked to abnormalities in chromosome 15q11-13. Interestingly, research shows that patients with the deletion abnormality of this gene have more prominent notched delta patterns compared to those with other types of chromosomal abnormalities. This makes the pattern a useful, though non-specific marker of Angelman syndrome. That's it, folks. Thanks for watching, and I'll see you next week for another 2 Minute Tuesday video.